Hi, I am Dr. Felice Gersh. I am your integrative OBGYN physician. We are going to talk about a topic that is overwhelmingly popular. It's how to have the most beautiful, young-looking, healthiest skin utilizing the wonderful bioidentical hormones. Well, I've said over and over that every organ system has receptors to estrogen and also progesterone. And we're going to touch just lightly on progesterone because it matters too. But the focus is on estrogen and its amazing impact on the skin. It's going to help every organ to be optimally healthy. And the biggest, widest spread organ of the body is actually the skin. It turns out that the skin is very reliant on estrogen to be optimally healthy. And what happens to us women when we transition into menopause? Of course, as the ovaries are aging, their production of that vital life hormone, estradiol, known as E2, the estrogen that's produced by the ovaries, declines in production, ultimately to have no production from the ovaries. Then we are relying on other sources within the body to produce estrogen for us, unless, of course, we're taking it exogenously. We're taking it as a hormone supplement or replacement to deal with this deficiency or insufficiency that nature inevitably creates in us females. It turns out that men, of course, also need estrogen, estradiol, in their skin. Now, how do they get it? They don't have ovaries making it. Well, it turns out that many organs in the body, and definitely the skin, have the enzyme aromatase that converts testosterone into estradiol. That's how men get estrogen in their skin. And of course, if a man's testosterone goes down, his ability to make adequate amounts of estradiol in the skin will also decrease. And he will also have aging skin as well as women. But women, although we also have that enzyme in our skin, we do not have enough testosterone. Plus, our skin isn't designed to make most of our estradiol from testosterone precursors and so on, like other androgens like DHEA and DHAS. No, that's not how females are designed. We are designed to get the bulk of our estrogen in our skin from our ovaries. But once again, our ovaries do not continue to make estradiol for the lifespan of a woman. Now, I throw around the terms estrogen and estradiol. So just as a reminder, estradiol is the estrogen made by the ovaries. Estrogen is a family of estrogens, and it includes in the adult female estrone, E1, estradiol, the one made by the ovaries, and estriol, which is the dominant estrogen produced by the placenta during pregnancy in a healthy reproductive aged woman or in a woman in the menopause who's receiving exogenous therapy with estradiol. She will have in her body an appropriate amount of estrone and estriol because the body can convert from one to the other. And we're not going to go into detail about that today, but if you provide estradiol and the other systems in the body are working well because you're doing everything with lifestyle, the body will produce estrone from estradiol and estriol from estradiol as it's needed. So estradiol is what we provide to menopausal and perimenopausal women. It's the ovarian-produced estradiol. So back to the skin. Well, women love estrogen for their skin. And why not? It turns out that every single structure in skin, every single layer of skin has estrogen receptors. When you don't have adequate estrogen, And now I'm going to say estrogen, but really I'm talking about estradiol. But we're going to touch on other estrogens like estriol for the skin. But now I'm talking about what I would give women, and that would be estradiol as a hormone supplementation or replacement. So if we think about the different layers and structures in the skin, they all require optimal estradiol to function properly. With aging, every one of these becomes deficient, and all the aspects of aging skin are a reflection of both the oxidative stress that's produced by the environment, the lack of enough estradiol to deal with the oxidative stress, and the inadequate amount of estradiol to maintain the basic functions of the cell types of skin. So if we think about the top layer of the skin, which has the keratin, the keratinocytes, the epidermis, all of that requires estrogen and absolutely optimal amounts. What about the moisture of skin? Hyaluronic acid, the ceramides, which you've heard of because they're used in different skincare products. They are produced as a response to adequate amounts of estrogen in the skin. And what about the fat in skin? You know, you've probably heard of people having fat transplants, like they get fat from their thighs or their butt and they inject it as a filler into the face because fat is naturally a very important component of youthful looking skin. You know, when they talk about a baby face, a young looking face, a lot of that is because of subcutaneous healthy fat in the skin. That's why when they talk about Ozempic face, if you lose a lot of fat in your face, you're going to age. It's going to give you saggy looking skin. So fat, adipose tissue, is really important for young looking skin. It turns out that adipose tissue, how it functions, its health, and where it's deposited is also controlled by estrogen. What about fibroblasts and collagen? So everyone knows that people sometimes inject or work with collagen. They will eat collagen supplements. They want collagen because collagen is a very important component of skin to make it be healthy and youthful in appearance. So estrogen is important for production and maintenance of collagen, and fibroblasts are very important for structure of the skin to keep it firm. Okay, you need healthy fibroblasts. So every single layer has receptors for estrogen. What about other parts? How about the hair follicle? Yes, the hair, and we're going to talk about hair in another episode. The hair follicle has estrogen receptors. What about the sebum? You know, when you get the secretions from like sweat glands and the moisture that comes on the skin, the fatty acids that come on the skin, the sebum, that is controlled by estrogen. What about the skin microbiome? Well, it turns out that every single structure in the body has its own unique set of microbes, the microbiome. The skin has its own unique microbiome as well. And estrogen, in conjunction with its very much under its control, the sebum, is very in control of having the appropriate microbial population on the skin microbiome. Now, every structure, as you now know, requires estrogen, and I always use estradiol when I'm giving hormone replacement or supplementation therapy to the whole body for systemic use. I always will use that type of estrogen because it turns out that if you're going to really want to control every structure in the skin, you want to have estradiol. That said, what about the different types of receptors and other parts of the body that contribute to the health of skin? So we talk about the direct components of skin, but what about blood supply to the skin? You need to have blood supply to deal with proper nutrition being delivered to the skin, oxygen delivered to the skin, healing of injuries. Well, you need to have healthy blood vessels. Now, blood vessels require both alpha and beta. Every structure in the body is not just one. They always have a blend with a predominance of different types of estrogen receptors. The arteries, they have a blend as well, but they are more alpha. And when you want to have more nitric oxide, this magical antioxidant gas that keeps vascular structures healthy, you really need to have estradiol, and it works through, in order to create nitric oxide, both the GPERS, the G receptor, coupled receptor for estrogen, and the superficial types of receptors, and also the alpha receptor. Okay, so you have membrane receptors, nuclear receptors. So it's a combination in order to make nitric oxide. So you wouldn't want to have healthy arteries only have something that acts on the beta receptor. And I'm going to come back to why this matters. So what about the immune system? One of the things that happens with aging is this status of chronic low-level inflammation, which can also affect the skin. It will affect the skin. So when you don't have a proper regulated immune system and you have more inflammation, you will have damage and you will not have proper repair. And you can have the immune cells producing enzymes that can actually harm the tissues. And you also need to have proper capability of repair. And so you need to have healthy, functional immune cells. That requires having alpha receptors. So that's important to know, that you also want beta, but you need to have alpha. What about mitochondria? Now, every cell in the skin needs energy. So for mitochondrial function, you need both alpha and beta. So to have optimally functioning skin, you need to have alpha and beta and the G protein coupled receptor activation capabilities. This is really important. That's why you really do want estradiol as the optimal hormone systemically. Okay, so this is really, really important. In terms of the individual cell types of skin, the fibroblasts, which are like the connective tissue and make collagen, they are more alpha. But when you look at some of the other cell types in the skin, you find that they are more beta. And I didn't mention one other thing, elastin. So elastin is what helps keep skin flexible and like elastic, like you pull on it and it springs back. If you took an elderly person's skin and you pulled on it, it would just stay pulled up. It doesn't spring back. So that springy back kind of characteristic requires elastin, which requires estrogen. Okay, so what are we going to do? I hope you're all convinced that aging skin ages because of oxidative stress, which can come from ultraviolet light, environmental toxicities, nutrient insufficiencies or deficiencies, and also, dramatically so, lack of adequate estradiol. So it's a combination. It's not just one thing, because even if you have tons of estrogen, wonderful physiologic levels of estradiol in your body, and progesterone, you're still going to have aging of your skin because of these other influences. So we know that we're just delaying, but delaying a lot, the aging effects of lack of adequate estradiol and progesterone. Now, it's really amazing what estradiol can do for skin healing. So this is really important because we have little traumas to the skin all the time. Now, there are wound clinics all over the place dealing with individuals who have trouble healing wounds, and they're just trying really hard. Well, it turns out that skin that has wonderful estradiol in it will heal so much faster. They've done so many studies looking at re-epithelialization, like having skin heal itself. It's dramatically faster, of course, in younger people than in older people, and much of that has to do with estrogen in the skin. So this is really important. Of course, it also involves having proper blood flow and proper immune system. So it's not just one thing. But remember, estrogen works on all of those things. So there's a ton. If you like to Google estradiol and wound healing, you'll see so many different studies. Many of the studies on estrogen and skin, both for aesthetics, for wound healing, for overall health, anti-cancer, let me touch on that. A lot of those studies predated that infamous, unfortunate study, the Women's Health Initiative. But some studies continued even after that whole horrible mess, and more are coming into focus now, looking at estrogen for the skin, and a little bit progesterone, not too much. But and I'm not going to forget progesterone because we'll come back to that, but estrogen for the skin. By the way, they've done studies on giving topical estrogen to males who have wounds that won't heal. And guess what? They heal faster. So, of course, it works for men because men love estrogen in their skin. They just don't know it. They make it, but don't know it from their testosterone. But as you know, men's testosterone goes down, down, down with aging as well, just not off the cliff like estrogen and women with their menopause. So, wound healing, very much promoted by estrogen. What about wrinkles? Well, I mentioned all the different structures. If you don't have enough estrogen, you won't have enough elastin, you won't have enough collagen. A woman going into menopause can lose 2% of her collagen every year. So that really translates into rapid visible aging of the skin. 2% of collagen lost every year. And there are so many studies now that have shown that giving estrogen, both systemically and topically, either and or both, will increase collagen in the skin and visibly reduce wrinkles in 2 weeks. 2 weeks, and you can see visible reduction in skin wrinkling, increase in elastin, increase in ceramides, hyaluronic acid, collagen. It's phenomenal. Improvement, as I mentioned, in re-epithelialization, that healing over from little wounds and such on the skin. So what about skin cancer? It turns out that topical estrogen and systemic estrogen helps reduce the incidence of skin cancers, as well with melanocytes. That's the cells of the skin that produce pigment. Now, you've all heard that going on birth control pills and in pregnancy, that women will occasionally get more pigmentation, like melasma, where they get like darkness on their cheeks, and that's what is cosmetically very undesirable, and certain areas will darken as well. The linea that goes up and down the middle of the body around the nipples of women will get more pigmented in pregnancy. That is because, I'm not going to go into it in great detail, but the estrogens that are dominant in pregnancy and in birth control pill use are not the same. Pregnancy, because of the difference in hormones, it alters the gut microbiome purposely to create a low level of leaky gut, to create a little bit of inflammation, to have a little bit of insulin resistance, to increase insulin, but not too much, a little bit, to increase the production and storage of fat in pregnant women so they gain weight quickly and hold on to their fat so that they have a fat store for breastfeeding and in case there's any kind of famine along the way while they're pregnant. So pregnancy, we do not want to recreate pregnancy. It's a little inflammation. And birth control pills also, because they are estrone. Taking estrogen orally creates more estrone, not estradiol, and estrone creates more pro-inflammatory state. Only estradiol modulates, turns on and off inflammation appropriately. It's the great master of modulation of the systems of the body. They have the on and off switch. Estradiol does on and off appropriately. If you have only estrone, it's like turning the on switch into a more pro-inflammatory state. When you have melasma, it's a sign of inflammation in the skin. It's not a sign of beautiful, healthy skin. Estradiol, the estrogen produced by the ovaries, we're not programmed to make inappropriate pigment. It's when you have inflammation that you have this reaction to create melasma, and that's in people who have certain genetic predispositions as well. So I don't want you to think that if you do everything to have an anti-inflammatory lifestyle and you measure inflammation markers, you do everything to reduce a lot of oxidative stress in the skin that can create inflammation, like a humongous amount of exposure to ultraviolet light that creates stress and inflammation in the skin, you will not have that melasma. So that's a sign of inflammation. I just don't want you to think that if you use estradiol topically or systemically that you're suddenly going to get melasma. You shouldn't unless you are in a very pro-inflammatory state. Okay? In fact, estradiol maintains proper pigmentation. And if you have proper amounts, you will have less likelihood of getting those so-called age spots, the darkened spots. It's not melasma, it's what we call age spots. Nobody wants that. And it's just very unsightly, and it's a sign of inflammation in the skin. We do not want that. So, estradiol is anti-cancer, pro-healing, improves the wound healing, improves blood flow to the skin, improves every skin cell type in the skin, retains proper moisture, collagen, elastin, all the different cell types work and are happy, proper fat in the skin, proper sebum, proper microbiome, and the gut. I have to mention this. Estrogen is critical for proper gut health and the gut microbiome, and there is a gut-skin axis. What goes on in the gut affects the health of the skin. So having proper estradiol, along with a great lifestyle, will give you a proper, healthy gut microbiome. And the gut microbiome has tremendous effects on the skin. And we'll talk more in detail about that another time. The gut-skin axis requires adequate estradiol. So, now that you know how important it is, what are we going to do about it? Because we do not want to have aging skin. We don't want wrinkles. We don't want age spots. We do not want to have wounds that don't heal. And just let me mention very quickly, acne. It turns out that that's very related to the gut-skin microbiome connection, intersection, and as well that when you don't have the right sebum and you don't have the right microbiome of the skin, which is related to the gut and to estradiol, as well as having a lot of androgens. But we'll talk about acne another time in detail. But just know that estrogen also helps acne, topically and systemically in a variety of ways. But we'll talk about acne in more detail another time. So now that we all want to have beautiful skin, we know we need estrogen, what are we going to do? Well, I recommend getting started early on estradiol supplementation, because you start losing all the optimal health of your skin cells, from everything from the keratinocytes, the fibroblasts, the adipose cells, every cell, and the vascular system that involves the skin, the production of ceramides and the everything, the hyaluronic acid, all the different things that have to do with having beautiful skin, all start to go downhill in the perimenopause. You will have aging of the skin before that official menopause. Remember, it's a process. The process of aging of the ovaries parallels the aging of the skin. So early start with hormone supplementation is really important to keep your skin looking young and beautiful. But what if you've already passed that time? We can't turn the clock back. You start where you are. Wherever you are, we can still do so much. So if you're already in menopause, you start hormone therapy, and you want physiologic levels. That means cycling, but we're not going to go into more detail about that. I'm just mentioning. Everything is dose related. You exercise 5 minutes a week, you're not going to get the same outcome as 30 minutes a day. You eat 1 serving of vegetables a week, you're not going to get the same outcome as 7 servings a day. You get 4 hours of sleep, you're not going to be as healthy as if you got 7 or 8. I'm sorry, there is a thing about dose, okay? If you take hardly any, I'm not saying it's not good. I always say any hormones are better than no hormones. You're not going to get the same outcome if you don't have physiologic levels. I'm sorry, there's magic in that dose. You got to get up to a healthy level. The result is going to depend on it. And so you want to get started on hormones at whatever age you are. I'm not going to get into detail today about what if you're out more than 10 years or 60. We're going to talk about that in more detail another time. But there are ways that almost, not everybody, of course there are exceptions, but the vast majority of women can go on hormones safely. Some need more prep to reduce inflammation ahead of time. We're going to talk all about that in the future. But most women can use very safely hormones wherever they are in their life journey. So the sooner the better. You can also put estrogen on topically. That is one of the most wonderful things that you can do. So if you are using compounded estrogen cream, you can actually put it directly on your face. Of course, you should do a little test, like everything. Test the spot first, just to make sure you don't react in any way to the cream that the estrogen is being mixed into. Now, I am going to tell you what I do, okay? I use organic shea butter. Now, this happens to be what I'm using. I have no relationship with this company. This is an organic shea butter, certified organic. So, by the way, what I'm telling you, there's no studies on. I just made this up myself, and it works for me, so I'm just going to share it. I'm not telling you should do it. Okay, I take a layer of shea butter, and I just wipe it everywhere, on my face and my neck, and in my hands, okay? And then I'm using compounded estradiol cream, but this is not what I use with everybody. I'm just sharing my personal secret, which I made up, okay? This is my concoction, okay? I take my estradiol cream, which is compounded, and I make little dots, and I can't put it, I don't have enough volume to put it everywhere every time, but I put little dots, and then I rub it in the areas that I want the most benefit from. So I'll often around my eyes, upper lip, forehead, wherever I feel, where I want it, and I put some on my cheeks. So I rotate around the spot, and sometimes I just put it on the tops of my hands and rub it in. And I'm not kidding, but I'm not saying my hands look like a 21-year-old, but I had more brown spots. I haven't been doing this for that long because nobody taught me this stuff, okay? Nobody is teaching this like I'm telling you, okay? So I put a little bit on my hands, and I have had a regression of little age spots on my hands, okay? So, and on the face, and also like little age spots, and wrinkles go down, down, down. Remember, studies show just 2 weeks of topical estrogen on the skin, estradiol, will reduce wrinkles. Now, what about estriol? I have to mention estriol. As I mentioned, the bulk of the skin cells, the ones that make up the different layers of skin, are more dominant beta. So you can use small quantities of estriol on the skin, and you will also get benefits. I personally like estradiol, but I recommend for a lot of my patients who are also on systemic estradiol, because there's data that just using systemic estradiol will reduce wrinkles and maintain skin. Because look, if you have a 25-year-old, what 25-year-old is putting estradiol on her face? None of them. They don't need it. They don't want it. So if you get enough systemically, and you're young, you're like perimenopause, you probably don't need to actually put it much on your face because you have systemic physiologic levels like a young woman. A young woman doesn't put estrogen on her face. She doesn't need it. A young woman doesn't put estrogen intravaginally, which is also a type of skin. The vagina is skin, okay? They don't put it there because they don't need it. So if you start early and you have a high enough physiologic levels, you don't need to do all this other stuff. You just get normal levels in your body. It goes everywhere. It goes to your skin. It goes to the vaginal skin. It goes everywhere. But if you need to you already have wrinkles, and it's not just prevention, you're trying to regress them, then you can put some on in the areas that you feel need the most benefit to reduce wrinkles. And you can do that with straight estriol too. You can just put little amounts and rub it in every day. And progesterone, I told you I was going to mention progesterone. Progesterone also has receptors in the skin. Progesterone is very anti-inflammatory. The last thing you want is inflammation in your skin. So a little bit of progesterone cream can also help to maintain young, beautiful skin. So that is another little secret that you can do as well. And don't forget phytoestrogens. There's actually data that people who eat, I try to be one of them, lots and lots of vegetables and fruits and grains and nuts, ancient grains, nuts and seeds that have all these different phytoestrogens, that will also maintain healthy, young-looking skin. So don't think that diet doesn't matter. You can help maintain beautiful skin just by eating lots of plants, all different kinds of plants. And the magical ingredients, the phytoestrogens, will help to maintain beautiful young skin. Estrogen and its sidekick progesterone are wonderful hormones. They're life hormones, and they're the basis for beautiful skin. So you want them systemically, and if you already have wrinkles or you really are wanting to do everything maximally, you can get topical products from a compounding pharmacy. And I use one, and they have a wonderful product. My patients love it. That has a little estriol, some progesterone, and other ingredients I'm not going to go into that really help to reduce wrinkling and maintain healthy skin from the inside out and the outside in. And if you're using compounded estradiol cream, you can also talk to your physician. I don't want to tell you what to do, but you can put it on your skin as well. And what I said I did in quick summary is I put on a thin layer of the shea butter. Then I take the estradiol cream and rub it in through the shea butter into my skin. I rub it in all the areas that I really want to reduce wrinkles. And I think it's been fantastic. I love it. It will absorb into your skin. If you're giving it through the skin, it will absorb and go into your system and will go everywhere. That's why if you don't want that, or you are using a different form of estradiol, whether it's a patch or a gel, these are wonderful products as well, and you just want that little extra, and you try to get the level up good, but you want a little extra, then you can use a compounded product that has the estriol, because the estriol will not grow the uterine lining anywhere near like estradiol will. It has different effects, and most of the layers of the skin have predominantly beta, which estriol works on beta. If you combine the topical estriol, progesterone, and you have systemic estradiol, that will help maintain vascular health and so forth, and the gut microbiome, you have an excellent combination there. As far as using vaginal estradiol on the face, I wouldn't do that. It will absorb, but it's a very tiny amount. It's very small. And here's another thing to know. The commercial products have parabens, methyl parabens in it as a preservative. I personally would not want to put parabens on my face. So it's a preservative, and they are required by law to have something in them. I would not use vaginal estrogen on my skin. That's my opinion. I would not do it. I don't like the ingredients that they put into the cream. I want something from a compounded pharmacy that doesn't have chemicals, especially parabens. So that's my opinion, and I hope you'll all go and eat lots of vegetables, lots of phytoestrogens, and talk to your personal medical healthcare professionals about physiologic dosing, cyclic hormone, so you can get it up high enough to actually have the optimal effect. And if you like, work with a compounding pharmacy to get some of these special custom-made products for helping to maintain young, healthy skin.